The MD Anderson Cancer Center in Houston, Texas is one of the top centers in the country for mesothelioma clinical research. They have an entire department dedicated to mesothelioma with over 20 staff members including physicians, nurses, researchers and clinical trial coordinators. MD Anderson currently has over 20 open clinical trials for mesothelioma examining new drugs, combination therapies, immunotherapy and various treatment approaches. Some examples of their current mesothelioma trials include studies of immune checkpoint inhibitors like pembrolizumab, nivolumab and ipilimumab alone and in combination with chemotherapy, trials of angiogenesis inhibitors like bevacizumab, and studies examining targeted therapies and nanoparticle drug delivery systems. MD Anderson also conducts many translational research projects to better understand the biology and genetics of mesothelioma to identify new therapeutic targets. The Dana-Farber Cancer Institute in Boston is another leader in mesothelioma clinical research. They have an active mesothelioma treatment center and currently have approximately 10 open clinical trials for mesothelioma patients. Some of their current trials are examining immunotherapy combinations, epigenetics drugs, anti-angiogenesis therapies and targeted agents. Examples include studies of the PD-1 inhibitor nivolumab in combination with ipilimumab, the PARP inhibitor olaparib, and the MET/VEGF inhibitor cabozantinib. Dana-Farber also conducts correlative science studies embedded in clinical trials to gain more insights into mesothelioma and discover new biomarkers. The researchers have published many influential studies advancing the understanding and treatment of this disease. The University of Pennsylvania's Abramson Cancer Center in Philadelphia has a renowned thoracic oncology program and several open mesothelioma clinical trials. Some examples include studies of multikinase inhibitors like nintedanib, immunotherapy drugs like pembrolizumab and nivolumab, combination chemoimmunotherapy, and targeted agents like the MEK inhibitor cabozantinib. Penn is also examining treatments aimed at controlling pleural effusions like intrapleural bevacizumab. They conduct translational research in mesothelioma through various cooperative groups to help advance new targeted therapies to the clinic. The University of Chicago Medicine Comprehensive Cancer Center also has an established program for mesothelioma clinical care and research. They currently have approximately 5 open clinical trials for mesothelioma patients evaluating approaches like immunotherapy with pembrolizumab and nivolumab, combination chemoimmunotherapy regimens, targeted therapies inhibiting pathways like MTR, and intrapleural treatments. University of Chicago researchers have published important studies developing new genetic and immunologic risk stratification biomarkers to help guide individualized mesothelioma treatment. The University of Cincinnati Cancer Institute has a long history of mesothelioma clinical research leadership. They currently have approximately 10 open clinical trials examining a variety of therapeutic strategies for this disease, including studies of checkpoint inhibitors, TEC inhibitors, angiogenesis inhibitors, and novel drug combinations. Some examples are trials evaluating nivolumab and ipilimumab immunotherapy, the TEC inhibitor belinostat, and bevacizumab plus chemotherapy. UC Cancer Institute investigators also conduct pathobiologic and translational studies to develop new biomarkers and elucidate mechanisms of drug resistance and mesothelioma to support biomarker-driven clinical trials. The Seattle Cancer Care Alliance, which encompasses Fred Hutchinson Cancer Research Center, University of Washington and Seattle Children's, has one of the largest clinical trial portfolios for mesothelioma in the country. Currently they have approximately 15 open studies evaluating therapeutic strategies like immunotherapy with checkpoints inhibitors alone and in combination, targeted agents against pathways like MAP and MTR, vascular disrupting agents, and biomarker-based treatment approaches. Some examples include trials of pembrolizumab, larotrectinib, cabozantinib and cediranib. Seattle Cancer Care Alliance investigators frequently lead national and international cooperative group clinical trials to test promising new treatments for mesothelioma. The Mayo Clinic Cancer Center has a long-standing program of excellence in mesothelioma clinical care and research. They currently have approximately 8 open clinical trials evaluating approaches including immunotherapy with nivolumab and pembrolizumab, combination chemotherapy regimens, gene expression profiling to guide therapy, and treatment of malignant pleural effusions. Mayo Clinic researchers also conduct many basic science and translational studies on mesothelioma aimed at elucidating the disease pathogenesis and discovering new drug targets. Their studies have contributed important insights regarding tumor genetics, epigenetics and immune evasion in mesothelioma. The UT Southwestern Simmons Comprehensive Cancer Center in Dallas has built an esteemed thoracic oncology clinical trial portfolio, with about 5 current mesothelioma studies. Examples include trials testing immunotherapy chemo combinations, angiogenesis inhibitors, and targeted agents. UT Southwestern investigators also conduct insights-driven correlative science research embedded in trials to define biomarkers predictive of response or resistance to various novel mesothelioma therapies. Their past work has helped advance immuno-oncology approaches for this cancer type. These leading academic cancer centers represent some of the top locations in the United States actively conducting mesothelioma clinical trials and research. Collaborating as national and international consortia, their investigators are making important progress advancing novel targeted agents, immunotherapies, and combined modality approaches with the goal of improving treatment outcomes for this devastating cancer.